Today I'm going to teach you about the corrected calcium level. So in our daily practice, when we see the calcium level in our laboratory, let's say if calcium level is uh, let's say 7.5. So if we don't know that we have to correct for the albumin level, we'll go with the 7.5 and might replace the calcium, which might be harmful to the patient. So before you think of replacing the calcium level, which normally is between about like 8.5 to 10.2, which is the normal level of calcium roughly. So if you see 7.5, you might say, oh, it's low, and then you might go and replace it. However, you need to think about the albumin level first. So look at the albumin level. If it is, let's say 4, then you are right, it's 7.5. You need to replace it to maybe make it 8.5. However, let's say if the albumin level is like 2, then you would know like you have to correct the calcium level first before thinking of replacing it. So normal, the rule of thumb is like you need to see like how much is low from the normal. So when you assume normal is like 4, then we replace we subtract that 2 and it will come back to, so you have to replace your corrected calcium level. So corrected calcium level would be somewhere like, let's say corrected calcium level would be 7.5 plus 2 times 0.8, so which would be like 7.5 plus maybe like 1.6, which would roughly like 651. 7.5 and 1.5 would be like 8 9 9.1 maybe. Yeah, 9.1. So now see, this is within the normal level, so we should not be correcting it, and it happens because of the ionized calcium level. So usually albumin has negative charge, which will neutralize the positive calcium ion. So whenever there is less albumin, that means less of the calcium get neutralized. So this is my quick introduction about correct calcium level. Please go through the textbook and find it out. But however, this is just a kind of like a brief introduction saying like don't go with the first calcium level whatever you see, and rather than that, instead correct it and then go from there. Thank you. I hope it helps.